For our next lesson, we are going to talk about medical problems. Medical problems can range from very minor to life-threatening emergencies. The first aid responder must be prepared at any time to intervene and possibly initiate CPR. As a responder, if you are untrained in CPR, give hands-only CPR and just give compressions. Breathing problems can arise from underlying disease and illness such as asthma and pneumonia. Other medical conditions such as a heart attack, stroke, seizure, or anxiety can cause breathing problems. Signs of a breathing problem include rapid and noisy breathing, wheezing, inability to talk due to breathlessness, and unusual sounds. High-pitched sounds during inhalation suggest a partial blockage of the upper airway. Here's the technique for using an inhaler. First, shake the canister. Then place the opening of the inhaler into the spacer if available. Instruct the person to inhale fully. Place the spacer or inhaler into their mouth. Simultaneously, have the person inhale slowly and deeply while pressing down on the top of the inhaler canister. Instruct the person to hold their breath for up to 10 seconds if possible. Be prepared to repeat. Stay with the person until the symptoms improve or emergency response arrives. Allergic reactions can arise from insect stings, illness, or adverse reaction to foods or medicines. Common triggers include nuts, eggs, fruits, medications. Hymenoptera stings can produce rapid and potentially fatal reactions. Symptoms can be mild or severe and include itching, hives, and swelling of the lips and tongue. Epinephrine can be life-saving medication. EpiPens are simple to use. Form a fist around the pen and remove the safety release cap. Place the orange end of the pen against the outer mid-thigh. Push down hard until a click is heard or felt, and hold the pen in place for 10 seconds. Remove the pen and massage the site of injection for 10 seconds. Properly dispose of the used device in a sharps container. Remember the time of injection. And seek medical care. Antihistamines such as Benadryl are also important in the treatment of severe allergic reactions. Next, we're going to discuss heart attacks. Chest discomfort could be described as an ache, pressure, squeezing, or crushing. Women and diabetics are less likely to show symptoms of a heart attack. Aspirin is the most important medication if a person is having a heart attack. Follow these steps when caring for a person experiencing a heart attack. Keep the person and yourself calm. Have the person sit or lie down. Activate the emergency medical system and call 911. Administer 1 adult strength or 4 low-dose aspirin tablets if there are not contraindications, and be prepared to administer CPR. Don't allow a person suspected of having a heart attack to drive his or herself to a hospital. Encourage them to wait for EMS, and if they refuse, find someone to go with them. Next, we are going to discuss fainting. Fainting is a common reaction to a variety of conditions. Persons may faint at the sight of blood or during periods of intense emotional stress. Erratic heart rhythm and dehydration may also cause fainting. In caring for a fainting or fainted person, ensure safety of the scene. Help the person lie down and call 911 if unresponsive. Low blood sugar in diabetic persons affects a person's ability to regulate blood sugar. Fluctuations in blood sugar in either direction can produce symptoms. Diabetic persons can experience low blood sugar due to illness, stress, skipping meals, or taking too much insulin. Symptoms of low blood sugar include agitation, confusion, loss of consciousness, tiredness, weakness, and seizure-like activity. When caring for a person that is diabetic with low blood sugar, give them a sugar-containing beverage, encourage them to sit or lie down, and call 911. If symptoms improve, encourage eating. A sudden decrease or blockage in blood flow to the brain results in a clinical condition called stroke. Persons experiencing a stroke will have noticeable neurological deficits that can include slurred speech, facial droop, numbness, weakness of one side of the body, difficulty walking or balancing, loss of vision, severe headache, and loss of consciousness. If you suspect someone is having a stroke, call 911 immediately. Help the person sit or lay down. Retrieve AED and first aid kit. Record the time that neurological symptoms were noted, and be prepared to perform CPR if needed. Seizures result in abnormal body motion due to an irregular electrical discharge in the brain. Epilepsy is a chronic medical condition resulting in seizures. Seizures can involve one or more sides of the body, and many result in rhythmic jerking motions, but some involve a blank stare type of behavior. Causes of seizures include epilepsy, low blood sugar, head injury or trauma, heart disease, heart-related illness, and ingestion of a toxin. When caring for a person, help them to the ground if needed. Clear the area around them to prevent injury. Place a small pillow or towel under their head and call 911. After the seizure is over, position them on their side. Support their airway if needed. Feel their pulse and stay with them until help arrives. If a person is experiencing a staring-type seizure, treat it like any other seizure. Shock can be caused by overwhelming infection, blood loss, severe allergic reactions, severe dehydration, or heart problems. When blood flow is significantly reduced, the body is not receiving an adequate supply of oxygen. The signs and symptoms include poor skin color that is pale, gray, or bluish, dizziness, lightheadedness, nausea, vomiting, behavior change, and clammy skin. If a person is experiencing shock, activate the emergency response system. Help the person lie down. Cover the person with blankets to keep them warm. Be prepared to perform CPR, and stay with the person until help arrives. That concludes the medical problems lesson.